Okay, hi everybody. Welcome to the Bachelor of Nursing orientation session. I'm Pauline Hill. I'm one of the Bachelor of Nursing course coordinators, and my partner in crime is having a nap. No, it is Deb O'Kane.
Hello, I'm Deb O'Kane. I'm the other course coordinator, so you get one of us or both of us, or depends if you're lucky, they might get both of us.
Now, can I just double check how many of you in the room are doing the enrolled nurse entry pathway? Hands up. Okay. Some of you are doing a 3-year pathway. Hands up. Hi. There you go. Now we can see you. And the others who didn't put a hand up, I'm not sure. Are you doing a Bachelor of Nursing? Yes. I think you're doing 3 years. No, just checking. There's a lot of orientation sessions on today, so we appreciate that sometimes it's easy to go into the wrong room, so just don't want you to be sitting here thinking, I don't think I need to be here. I also want to say hello and welcome to the students that we have who are listening to this online. They may not have been able to get here today, so they might be listening live online, or they may be listening at a later date online if they're not available to do that at the moment. I'm going to start with a video from the Vice-Chancellor welcoming you to the university. Hopefully I'll get this to work. I wasn't successful this morning.
To take this opportunity to welcome you to Flinders University. Every year is terrific to see new faces on campus and to know that so many people have chosen to study here at Flinders. I love walking through the hub, feeling that incredible buzz and seeing students just like you, talking to new friends, sharing ideas, helping each other. These are just some of the things that make Flinders such a wonderful place to study, as I'm sure you'll discover once you find your feet. Your first few days may seem a bit of a blur, we've all been there. Starting university is a big step, and it takes time to learn all the ins and outs. But don't worry, plenty of support's available to help make your transition to life at Flinders as easy as possible. Flinders staff and student ambassadors can help you find your way. And I know from experience that your fellow students are kind, inclusive, and always ready to help. So where do you begin? Well, Flinders' website's a great starting point. You'll find campus maps, plenty of information about university life. Our Ask Flinders Facebook page will keep you up to date on university events and Flinders news. Flinders also has a busy social site. Flinders University Student Association, FUSA, can help you find social clubs and many other activities. As well as online support, we also provide support in person at our campus locations at Sturt, Tonsley, Victoria Square, regional South Australia, and across the Northern Territory. Here at Bedford Park, the Flinders Connect team in the hub can answer questions about enrolments and course information. The Student Learning Centre within Flinders Library is also a great resource for any academic help that you might need. Our confidential and professional health, counselling and disability services are available to all students. And Flinders Oasis drop-in centres is a warm and inviting space for people from all backgrounds to socialise. Oh, and of course, Bedford Park has plenty of food outlets, although I'm sure you've discovered those for yourself already. I'm confident that you're going to love being a student here at Flinders University, and I hope you're going to have the time of your life.
Okay, so that is the Vice-Chancellor, Colin Sterling. I'll just close this down and get us back to our slideshow.
This has got to be the most intelligently located.
Okay, that might be in the background. I'm still on YouTube. Let me just, my apologies. Let me see if I might just turn that off. Okay. I'm really good at these epic technology fails today, so that's okay. Here we go. So one of the things that's really important to us here at Flinders University is acknowledging the country and the land on which the Flinders University sites are located around the country. Here at Bedford Park, we're on the lands of the Kaurna Nation, and we acknowledge the traditional owners past, present and emerging, and we recognise their continued relationship and the responsibility to these lands and waters. Here at Flinders, we have a reconciliation action plan, which you will hear about across the 3 years of your program, or 2 years if you're in the 2-year program. And there'll be more activities across that time as well that you can actively participate in. And of course, you'll be doing topics where you'll be learning about Indigenous health as well. So that will be a core part of your program. While we're doing this presentation, if you've got questions that you think of that you would like to ask, you can always put your hand up if you're in the room, but you can also, both in the room or if you're online, you can use the Slido link. So we've got the link written there if you want to pop that in your mobile device that you may have on you, and you can access that and submit a question using the password that is listed there, the OWK and then BNGU. So if you just write that down or pop that into your mobile device that you might wish to use, and then you can ask questions as we go through. If we can, we'll answer them as we go through. I'm sure we'll have time to do that. And what it means also is that if we get lots of the same questions, we'll compile those to make them a frequently asked question page to help you in the next couple of weeks as well, to make sure you've got all of that information clear. So we've introduced you to the university, but the university has 6 colleges, and so you're now a part of the College of Nursing and Health Sciences. And, you know, at the heart of this college is this, the advanced learning around health services, healthcare, nursing, midwifery, and a range of allied health professions. And so in the college we interact and work with people from a range of disciplines, both on staff and also undertaking courses here, mostly here at the Sturt area of the university, up the hill for some people as well, as we call it, or the main Bedford Park campus, and also sometimes across the road at Flinders Medical Centre. They may be down at Tonsley, or some of those other campuses that were mentioned by the Vice-Chancellor as well. We also have a campus up at Renmark in the Riverland, and we run the 3-year program up there. So sometimes you'll hear us talking about our Renmark students. So we have a group of students up there in 1st, 2nd and 3rd year. It's approximately 25 to 30 students in each of those year levels up there. So you may hear from or hear about Renmark students. So that will hopefully make a bit more sense as we go through. So each college has a Vice President and Executive Dean. So for the College of Nursing and Health Sciences, that's Professor Alison Kitson. She's not able to be here at this particular time, so we've got a link, and I'm going to really hope that I can get this to work from here. Let's see how we go. Fingers crossed. Spinning. Oh my goodness, it might work. Uh-oh. Uh-oh. Yeah, that doesn't like... I'm going to try my other link. I think this other link might be better. That doesn't look any better, does it? Oh. Hold our breath for the IT to work. Yay.
Oh. Hello, my name is Alison Kitson, and I'm the Vice President and Executive Director of the College of Nursing and Health Sciences here at Flinders University. Now, and first of all, I would really, really like to welcome everybody here. You realise that in the first 3 weeks of your time at Flinders, the people that you will meet, the 10, the 15, the 20, will become your friendship group over the next 3 or 4 or 5 years that you're going to be studying at the university. That was what happened with me all those years ago, whenever I did an undergraduate degree at the University of Ulster in Northern Ireland. So in the first 3 weeks, we want you really to get to know each other, mix up, find out as much as you can about each other, because actually the time that you spend with other people, other disciplines, other groups is really going to make you the right sort of professional that you want to be, whether you're caring for people with disability in the community, whether you work in hospital, whether you work in aged care, whether you work in any of the other industries that you will be going to once you've finished your degree with us. But not to forget about the first few weeks, the first few days, the first hours of you being here. We want you really to enjoy it. Get in there, explore, introduce yourself, ask loads of questions, because that's what these next few weeks are all about. Settling down. Yes, the campus might look really, really big, but there's loads of friendly people, there's lots of signage, there's lots of places you can stop, have a coffee, have a drink, and talk to people. Also, don't forget that being a health professional and from the College of Nursing and Health Sciences, you will be out and about, you're going to be in clinical placements, you're going to be meeting with lots of people, so it's a really fun-packed program, whether you're a nurse, a midwife, an allied health profession. So all I just want to say is have a great time. If you see me, stop me, say hello. I'd love to hear how you're settling down. And most of all, enjoy yourself. Bye.
I'll close it down this time so we don't get any extra little noises afterwards. Okay, so I'd like to introduce you to the team that are here in the nursing teaching section and in the Bachelor of Nursing. So I'm going to start with our academic lead, Suzanne Pearce, Associate Professor Suzanne Pearce. If you come on over. Come on over. You have to be on screen, you see, because otherwise our people online can't see you waving.
Yes, good afternoon and welcome. It's lovely to see you all here and embarking on the really exciting journey of going to university, and on top of that, having chosen one of the most exciting professions in the world, I would believe. So I myself, 20 years ago, sat in those chairs at University of Southern Queensland, being excited about starting my career in nursing, and it has been incredibly fulfilling, and I don't regret for a minute having done my nursing degree. So all the best to you. Just like Alison said, if you see me, have a chat to me. I might also be teaching you in some of the topics, so I'm really looking forward to get to meet you. So welcome.
Thanks, Suzanne. Now, Tiffany Conroy is our Teaching Program Director. So, okay, so Leanne's just remembered she was going to text her to tell her to come round, so she might come round in the near distance. Yeah. So when Tiff comes in, we will introduce her to you. So you've already met myself, Pauline Hill, and Deb O'Kane sitting down the front here in the room. You didn't really pop up and say hello on screen, Deb, so I think you need to come up.
Hi, I'm Deb O'Kane, for those people who didn't hear me before. And yeah, I'm the course coordinator, so welcome. And I'm sure the next 2 or 3 years are going to be exciting, invigorating, and hopefully you don't get to see Pauline or I very much. But that means that if you are passing in the corridor, please feel free to say hello. Or if you get lost, that's usually the common one that people end up doing, getting lost and saying, where do I go?
If people end up down my end of the corridor, it usually means they're lost because there's no classrooms down there and they've gone left when they should have gone right. We also have year-level coordinators in the Bachelor of Nursing program. So Katrina is here, who is our first-year coordinator.
Welcome. Great to see you here today. That's probably all.
You're going to be there, TC.
Oh yes, as well as the first year coordinator, I topic coordinate a few other things. So I'm the topic coordinator for the availability 2 of NURS 1001, which is the Introduction to the Nursing Profession and Independent Learning. So if you're on a 6-week pathway, I'll be your tutor. And
6 weeks for that topic.
Oh, sorry. Yeah, I'm your topic coordinator for the 6 weeks. And if you're offshore studying, I'll be your topic coordinator for the 12-week program. And I also topic coordinate in the 3rd year, and teach across a number of different topics. So you'll come across me, you can't get away from me.
And you won't want to either. Our 2nd year coordinator is Fatima Shafaza, and some of you being in the BNGUC pathway will be doing 2nd year subjects straight away.
Hi, welcome everyone. So I might see you in the second. Right. Too short.
I don't want you to hide behind the screens.
That's all right. I might see you in the second half of the year, because if you're going to be doing 2006, I'm your topic coordinator for that. And also I'll be doing some of the. No, I'm lying. I'm not doing any 1st year teaching this year, so no, I won't see you in any 1st year topic. But 2nd year topics, I might come and see you in the labs or in other tutorials.
Thank you very much. And Jodie Price is our 3rd year coordinator, and she is very busy in the labs at the moment. Our 3rd year students have been busy in the labs and the classrooms since the 4th of January. They're about to go, or some are out on placements and some are about to go out on placements. So the reason I particularly mention that is to highlight the fact that you might start at the beginning of an academic year this year in March, but in the subsequent years your topics will commence at the beginning of January. And so we don't always fit into the normal or typical academic year. We go potentially across the whole year, and you will have breaks at different times during those years. That's an important message for you to hear, because it means that if you're planning holidays, weddings, you might not be able to do that like you thought you were going to be able to do that. So the short answer is don't. The next answer is come talk to us if you need to do something like that, so that we can help you work out what might be a reasonable option, okay? So when we know that you'll have a break. So please come and talk to us. Our Placement Education Coordinator, Leanne Pront, is here. Come on over, Pronty.
Thanks.
Sorry.
Hi guys, how you going? Who's excited about starting their registered nurse program? Oh, come on. Placements, are you excited about placements? Yeah, awesome. We're going to have a chat in a minute about placements, so we'll leave it till then. I'll talk to you soon.
Thanks, Leanne. Danielle Cross is our Student Engagement Coordinator. She's not able to be here, but I will show you a picture of her later on and talk to that and put that on the screen, so you will get to know who she is and how to find her. We have got some of the topic coordinators here. So myself and Katrina is here, and Hilla is here. Come on over, Hilla.
Hi everyone, my name is Hilla Daphne and I'm very happy to see you today. I want to welcome you to Flinders University and also to the most amazing profession. I think you did the right choice when you decided to become an effective registered nurse. So I'm the topic coordinator of NURS 1002, which is a context of nursing and primary health care. In this topic you will learn a lot of clinical skills and behaviors and a lot of caring, how you should care for your patients, and communications as well, and that will help you to become an effective registered nurse, but also to be prepared better for your placement. So, welcome and a lot of good luck with your journey.
Thanks, Hilla. Vanessa is not able to be here today. Unfortunately, she's unwell today. But Didi is here, who is the topic coordinator for 1004 and has a few other roles she'll explain to you too.
Hi, good afternoon, everybody. So, yes, I'm the topic coordinator for 1004, which is physical dimensions of being human. So, those of you who are enrolled nurses won't be doing that topic. Those of you who are doing the full 3-year program will be doing that. So I look forward to seeing you there. I also have a couple of other hats that I wear. One is the Disability Contact Officer. We know that across Australia there are over 70,000 students who have got a disability. Flinders University is very supportive of students with disabilities. So realising that only 5% of disabilities are physically visible. Many other disabilities are invisible. So come and see me, or go and see the disability officers up at the health centre. We have many supportive policies in place to help you meet your learning outcomes and get through your degree. The other hat that I wear is the Equal Opportunity Contact Officer. So Flinders University is a safe place, and it's a no bullying site and no harassment. If you or you know of anybody who is experiencing that, then contact any of the academic staff or the professional staff, and they will put you in touch with myself or the other contact officers around the campus, or in fact the university. So don't be afraid to say hello, and I look forward to seeing you around. Okay, bye for now.
Thanks, Tidy. And go to our next screen. Probably one of the most important people for you to meet, actually, is Alicia Mader, who is now, I'm not going to try and get your title right. I'm going to let you introduce yourself because I will get it wrong.
Thank you. She's very, very kind. My name's Alicia. I'm the Enrolment and Course Advisor for nursing students. So I absolutely love my job. It is the best thing ever. I love meeting all you guys. I love helping you with your study plans, with your seeing you from the very, very start right through to the end of your degree. So my job is to make sure that you're enrolled in the right topics, to make sure that you're following the study plans correctly, that you're meeting the prerequisites, because there are quite a few prerequisites in the Bachelor of Nursing pathways, and that can sometimes mean that if you don't move through them in the right sequence, that it can hold up your study plans and add time to your program. So it's really important that if you have any questions or concerns about your study plan, or you're not sure, that you come and see me. I'm located in the college office downstairs near the cafeteria. We're directly across from the cafeteria. So please come and say hello. Drop me an email at the end of this slideshow. We'll have my email address, and I'll pop it on Slido for you as well. So feel free to come and see me anytime. We can also help with your class registrations, your enrolment. If you've got credit applications, some of you I know have come into the 3-year program, but you are actually enrolled nurses and didn't have that credit applied at the start. So please feel free to contact me if you fall into that category, and I can certainly help with your credit applications that way. If you need to take leave at any time and from your study for whatever reason, I can certainly help with that as well. But yeah, otherwise I'm here Monday to Friday. Please pop in and say hello.
Thanks, Alicia. If you do, for whatever reason, need to change your study plan or take leave, it's really important that you let us know and that you have a conversation by email or in person with Alicia and work that out. If you take leave for any reason, we need to put you into a special category and make sure that we send emails to you when you're due to come back, so that you know what you need to do when you need to come back. We don't want to miss out, not send the information that we need to send to you, so it's really important that we know. The other part about that is important too is if we get worried and concerned about students that suddenly stop turning up to class. And so we'll send you emails and check in on you. And so if you don't come and tell us, you're going to really get sick of hearing from us. So it's easier if you just tell us. Or if you need to have a conversation about what's the best option, we can help you work through that just individually with whatever your situation is. So always come and talk to us. As we say, we're really, really good at supporting students, but we're not very good at reading your mind. So please tell us, and then we know how we can help you. Okay, it's really important. There's a few staff just exiting. They've got busy work to do. So the BN curriculum is designed as a 3-year program full-time, but you can take that part-time, and for some of you in the room, you'll be getting credit for previous study that you've done in the Diploma of Nursing. and working as as an enrolled nurse and be on the register as an enrolled nurse. And if that credit hasn't already been applied, as Alicia mentioned, Placemate Contact, the sooner we get that done, you'll be enrolled into the correct topics and make sure that we don't hold up your pathway at all. So that's really important to have that done sooner rather than later. The focus of the first year of the program is fundamental knowledge and skills and attitudes related to nursing. And during that time, there'll be a 2-week placement. And then in the second year of the program, we move that on to the sort of more complicated pathophysiology, pharmacology, and then up the ante, so to speak, in the clinical skills development. So people are getting more acute in their illnesses, and therefore the skills that you need to help look after them will increase as well. In second year, you do 2 4-week placements, and they'll generally be one at the front end of the year and one at the back end of the year. And depending on which availability you've enrolled into will depend exactly when that occurs. In third year, that's when you're starting to work towards becoming a registered nurse. So we have 2 8-week placements, and the focus is about bringing all of the knowledge you've learnt together and then adding that leadership, management, clinical decision making and professional expectations of you as you're about to become a registered nurse, so transitioning into that registered nurse role. You're up next, Pronti.
Awesomeness. So can I just ask, let me just get out of this one and then we'll pull this one up here because we don't really want to look at that face. Okay, guys. Who here is an enrolled nurse or has a diploma of nursing? Up high, up high, up high, up high. Okay, so not as many as... Okay, that's surprising. Not even half. Even better. They're busy working, true. Okay, so for those guys that just put their hand up, they will have a 2-year pathway. For the other guys, I'm making an assumption that you are what we call a Bachelor of Nursing pre-registration program, which means you're a 3-year pathway. Okay, does that make sense? Yep, excellent. All right, both groups will be going on placement. Who's excited about placement? Oh, well, that's more hands than last time, so we're working on it, aren't we? That's excellent. All right, so what I want to just walk you through is what is a placement for those of you that have never been on one, when and where you might go, what it might look like, and how you are going to get there, because there are some really critical steps that you need to follow before you can be allocated a placement. So, your clinical placement is a core part of your program. It is where you will go and practice the skills of nursing on real patients. You will apply the theory that you've learnt in your classroom, and you will be working closely with the staff on the ward and have a facilitator to help facilitate your learning, for the want of a better word. It is real life patients, so your actions have consequences. So therefore, you have to be able to meet some expectations before you go there. And we call that a risk management process, and that includes things like assessments such as medication calculations. You have to get 100% before you go on placement. Just breathe, it's okay, it's day 1, it's all right. You have to meet all your placement compliances. So that means you have to have vaccinations, you have to have police clearances, you have to prove that you're not a murderer. True. You have to prove that you are the type of person that is safe to care for the most vulnerable members of our community. Bottom line, that's really what you need to prove to us. Okay? Because if it was your mum, you'd want me to prove it, wouldn't you? Yep. Okay. Key place to find the information about your compliance requirements is the placement website. So when you put in the search bar of the Flinders website, nursing placements, it will come up and look like this. If it works. It will look like exactly like that. It's magic. The 3 yellow boxes are key pieces of information for you. This one at the bottom will walk you through prioritising your preparation for placement. What to start working on first and where to go to access further help. Now, the really significant message here is start yesterday. Okay? Yesterday is where you need to have started this stuff. For those of you that have a nursing diploma, much of this stuff you've already done, but you will need to have it in accordance to Flinders University requirements. So your vaccinations you might have on a record for whatever your education provider was in your diploma, you will be required to have it on a Flinders immunisation certificate. Okay? So you'll need to make a doctor's appointment and have it transferred across. Okay? I know it's another job, but it's all about you being able to evidence that you've done this stuff in the format we require. So that's a really important piece of information. Print it off and follow it. The next, look at that. Don't you hate that? I so do not like that. Right, we'll get back onto our placement and we'll look at our other yellow box, which is the compliance checklist. So I'm not going to go through this item by item. All the information around compliance is on this checklist. It will walk you through anything that's blue and highlighted, will send you through to the next piece of information you need. You will require to complete all of these in preparation for having a placement allocated, not attending the step before attending, so having one allocated, okay? So you'll need police checks, you'll need DHS, you'll need tuberculosis screening, immunisations, deed polls, CPR, manual handling, etc., etc., okay? Once you've got it completed, tick it off. But did you notice one thing? Down this column here, one says 1 year, another says indefinite, another says 12 months, 3 years, not applicable, 5 years. Oh my God, they're all different. It is your responsibility to keep them up to date for the duration of your placement. So if they were to expire on the 2nd of March and your placement didn't finish until the 15th of March, you would not be eligible for a placement because you are no longer compliant. All these documents need to be in date for the duration of your placement. Yeah, make sense? Yeah, excellent. Okay, so now we'll go back rather than close that, and we'll look at our final one here, our little calendar. So when do you need to have these done by? So some of you are in Nurse 2002, which would be your first clinical topic, yes? So your AV3? So your due date is the 12th of March, which is about 3 weeks away. Start yesterday, yeah? Okay. If you are in 1002, so those 3-year students, you will not need to have all of these completed for a placement until semester 2. However, 1002, which is a clinical topic, does not have a placement attached to it, but these things are associated to an assignment. So you will still need to start working on them. Yeah? Awesome. So, key place for information is the nursing placement website. It has a whole range of information around all of the compliance information, how to prepare your uniform, your clinical badge, preclinical meetings which you need to attend before you go on placement. All of those pieces of information are on this website. So, we've talked about student responsibilities. Your compliance is your responsibility. We've talked about the placement calendar. The dates for each topic is on the placement calendar. You need to be compliant by that due date. Now, some criteria you won't be able to meet. So you need to apply for an extension, and that information is available on the placement website. Okay? If you can't find the piece of information you need, then you need to go down to the front office and speak to somebody in the placement team. Please do not go to your peers. Please do not go to, Pauline, can I wear purple trousers on placement?
Definitely not.
Oh, I'm supposed to say, yeah, of course. Deb, can I wear purple trousers?
Definitely.
See, I could go with Deb's piece of information because I trust her. I may choose not to go with Pauline's piece of information, not that I don't trust her, but the reality is, what are the rules? Who has ownership and clarity in the rules which need to meet every placement provider in South Australia and Northern Territory? The placement team have the rules. Okay, so go to the source if you can't find it on the website. Okay, moving along. What sort of placements will you go to? So the first question that a Diploma of Nursing student will ask me, and I'll guarantee half of you have already got it in your head, I've already done an aged care placement. Do I have to do another one? Absolutely you do, because you're no longer going to be an enrolled nurse. You're going to be a registered nurse. The roles are different, and for many of you, traversing that role difference will be very challenging because it's a different way of thinking. Okay, so yes, you will need to do another aged care placement. Yes, you will also need to do a rural placement. Yes, you'll do a general med surg ward. And yes, you'll do some sort of specialty, be for all the adrenaline junkies and ICU or an ED or blood, guts and gore type stuff, yeah? Exciting, awesome. Where will these placements be? They could be anywhere in South Australia or the Northern Territory if you choose to apply for a Northern Territory placement. You will get an email from the placement team seeking your expression of interest in a Northern Territory placement. If you choose to apply, please address the criteria in detail, and then your application will be reviewed, and if you're successful, you'll be able to go on a Northern Territory placement. An amazing learning ground. Absolutely incredible. Our rural partners for placements also are extremely supportive of students and will provide you a diverse learning ground. You know, if you go to Flinders Medical Centre on, now I'm going to get my wards mixed up and Rachel's not here to rescue me, 5C, which might be cardiac, you will see cardiac patients, yeah? If you go to Barry or the Riverland Regional Hospital, you will see patients from 6 months old through to 106 years old with any diagnosis. And you might care for any one of those during any shift that you're on placement. Does that make sense? Really rich learning. To go to placement, you will need transport. You will and may need to travel up to an hour. The reality is we will do our best to allocate you to a placement as close to home as possible. But it will depend on what placements we've been offered and how best we can match them up with you. So we need to consider prior experience, we need to consider where you live, and we need to consider what topic you're in and what experience you need to meet the learning outcomes of that topic. Does that make sense? So we'll do our best, but we can't guarantee anything, really. Your responsibility to travel. Rural placements, we will support you with accommodation. The university or the college has a wonderful reimbursement policy for rural placements where you will be reimbursed travel to and from your placement once. Doesn't cover coming home every day's off. But it will also support your accommodation costs while you're there as well. The only catch is you have to pay for it up front and then you claim it back after your placement. So essentially what that means is you have to go and do the placement before you get the money back. Yeah? Cool. All right. This is the placement process. The reason why we have due dates for your placement compliance is because it can take us up to 12 weeks to secure you a placement in the current system that we have to work with. Okay? So we need to meet these deadlines in order to meet the deadlines required of our placement providers. In order for us to meet those deadlines, I need you to meet your compliance deadlines. Make sense? Awesome. Preparation. Uniforms. Who's been to... Is Valerie Travis on campus today? Did anyone see the uniform team? Yeah? Ordered a uniform? All good to go? Excellent. What's the wait time? Did they say? Brought yours and you've got it and you're ready to roll. How cool's that? That's pretty cool. That's very impressive. Who has not got a uniform yet? Okay. Information's on the placement website if you don't get to catch up with them on campus. Okay? You are required to present on placement in your uniform. If you do not, the clinical venue can ask you to leave and you will not be provided another placement because it's an expected behaviour that you present as a professional. You're not only representing the university in your Flinders nursing student uniform, but also yourself as a health professional and as a future registered nurse. Remember, every time you go on a placement, you are going on a job interview. Nursing in South Australia is a small family. We all know someone. Or we know someone of someone else. Yeah? It is too small a community to not represent yourself in the best light possible. ID badges. Who's got a clinical ID badge so far? No one? Who's got a student card? Okay, so you guys that got a student card, you got them from Flinders Connect up the hill? Central Library? You did it online. Good job. You can do it online, or you can go up to Central Library up the hill and they will print you off a clinical badge. Now, the difference between your student ID card and the clinical badge is it's got less information on it. Your student ID badge has your ID number. We don't need that on a clinical badge, okay? All right? You don't need that many identifiers floating around. Placement compliance, have I mentioned that it's really important to start yesterday? Yeah? You got that message? Good. The other things that you will need to meet before you go on a placement are some topic requirements. So for those of you doing 2002, you will be required to complete a medication calculation assessment. In fact, you'll need to do that twice in second year and again in third year. As a registered nurse, you'll be expected to do it every year to meet your competency standards. Reckon that's important? Why? Dead right. So you don't overdose someone. That's exactly right. You need to show that you're safe. Good job. In place. So who set up their Okta? Yeah, good job, many of you. On your Okta, you'll see an icon that looks like that. It says in place. That is your placement database. So all your compliance documents that you complete need to be uploaded to in place. Every time a document needs to be updated, it's reloaded onto in place. Every time you are allocated a placement, it happens in place. The placement team who sit downstairs in the college office send you emails from in place about your placement. Okay, so everything about placement sits in place. When you upload the documents, the team downstairs will verify them. So by that we mean they will check them and make sure they are accurate and apply an expiry date. It's your responsibility to check the expiry date doesn't expire whilst you're on placement. Okay? Students will receive a series of emails reminding them of their placement compliance due date. And I'm sure some of you have already had them. Yeah? Already had some? God, I love it when a plan comes together. Whoa, that's awesome. It's got a due date on it, yeah? It's got a little message that says if you can't complete these by your due date, please apply for an extension, yeah? Yeah? It's got a little online form that you click on and apply for an extension, yeah? So the tools are there to assist you. We are very happy to support you in getting these requirements completed. However, if you do not get them started and you do not participate in the process, by the due date, you will get an email that says, "Dear student, we note you're still enrolled in NEST 2002, and we're seeking your intention of undertaking a placement in this topic for 2021. Your compliance details aren't complete and we're unsure whether you wish to do a placement. Please contact us within 3 days if you do want to do a placement." If you do not talk to us in 3 days, you will not get a placement. It's pretty self-explanatory, really, isn't it? If you're having trouble with something and you contact us within that 3 days, I'm very happy to have a conversation and work through some of the issues. But if we don't hear from you and we can't see that you're working on them because you're not uploading anything, then we make the assumption that you really don't want to do a placement and you will not be allocated a placement. All right? Make sense? Excellent. All your compliance documents should be kept in their original state in a folder so that you can put it in your backpack and take it to placement with you. Senior staff members may wish to check them because they have a responsibility to ensure anyone providing care to their patients or clients need to have met the criteria. Do not give anybody your original documents. They are yours and they are your personal information. Okay? Did I tell you start your compliance yesterday? Yeah? Good. Right. We've talked about emails. We've talked about emails around placements come from in place. They will come from cnhs.placements@flinders.edu. That is the placement team's website. When you are asking questions of this team around your placement, it is extremely helpful if in the header of your email you put your name, student ID and topic that you are referring to. These guys manage about 3,500 placements a year, and it's extremely helpful if it's easy for them to reallocate emails quickly. You'll get a quicker response. Phone number for the front office is up there. So the placement team are very happy to have a chat over the phone if that's helpful for you, if you need it. Placements will occur in both SA Health and private environments such as Calvary, Resthaven, St Andrews, Flinders Private, the Northern Territory. We've talked that it's about a potential job interview, didn't we? Yeah? The way you present yourself is the way that you want to be, present yourself in the way you want to be perceived as a really competent health professional. You're going to provide care to vulnerable people. You are not, and I repeat, you are not to work in any capacity whilst you're on placement. Didn't see too many frowns there. Were you expecting that statement? Awesome. Why? Oh, sorry. We'll just get a microphone for you, mate. Sorry.
It's getting recorded, so everybody can hear.
Oh, sorry. Because otherwise you might be too exhausted and not be able to focus.
I am super impressed with these groups today. Oh my gosh, absolutely correct. As a health professional, as a nursing student, you are registered with AHPRA. AHPRA have a set criteria and standard that you need to meet. You're aiming to achieve the registered nurse standards for practice. One of those standards for practice is having a perception of your physical and mental capabilities for safe practice. If you are tired, are you safe for practice? If you make a mistake and injure yourself or another person, and you've been found to maybe be working somewhere else the day before, and when it's added up, you're working 9, 10, 11 days in a row, are you safe to practice? You're not. Okay, for many of you, shift work will be a new phenomenon. It is exhausting. You're not only doing shift work, but you're also learning. That in itself is exhausting. Okay, so do not put yourself at risk. The other reason is COVID. Moving across sites and bodies of people increases the risk of transference. We are very lucky in South Australia, but our health system has put some really strict rules in place to keep us safe. And the reason why we're lucky is because we have these rules that keep us safe. And you have a responsibility to meet that. So you are not to work whilst you're on placement. Second year students will be expected to work all 3 shifts, nights, days and afternoons, and across the 7-day roster. So yes, that means weekends, and yes, it means public holidays. Oh God, I've got to organise this, I've got to organise that. You're going to be registered nurses, that's what registered nurses do. Okay? Hang on.
Will we do late earlies?
High probability. Absolutely. Why do nurses do a late early? It's because we offer patients continuity of care. So it's actually a preferred manner of delivering nursing care. You get to know your patient on the late, you can facilitate their needs quickly on an early. Yeah, makes sense? Awesome. Up there are the lengths of your placements. So in first year, in second semester, you'll do 10 days of placement. In second year, you'll do 2 lots of 20 days or 160 hours. And in third year, you'll do 2 lots of 8 weeks or 320 hours each. So just to reiterate, a successful placement is get compliant yesterday. Just checking.
I don't think you've mentioned that yet.
Oh, I'll just reiterate then. Start your compliance yesterday, yeah? Participate in your topic activities, and I cannot stress this enough. For some topics, you will have a pre-clinical assessment where you need to display that you are competent at the clinical skills you are expected to perform on placement. You need to be safe when delivering care to our most vulnerable members of the community. You will need to pass your medication calculation test at 100% because we don't want to overdose someone, yeah? And the only way you're going to achieve all of that is be proactive and be active in your learning. If you have an issue and are struggling with something, talk to your tutor. If you're not getting support you need, go to your topic coordinator. They are here to help you. We are all very good at helping you because we're registered nurses, but we're not very good at reading minds. Okay? I'm sure you've got some, Alicia.
Oh, this is my favourite bit because you guys ask the best questions. So we've got a couple of questions coming in through Slido. Please keep putting them through if you've got any questions, if you're watching it online or if you aren't in the room for any reason. One of them is, if I apply for a rural placement once, can I apply again for another rural placement in following years?
Absolutely! So most definitely, there are a couple of caveats on that. So if you originate from a rural environment and you plan to be a rural clinician, so when you register you want to work rurally, you want to go back home or to a regional area, we will do our best to provide you several rural placements because it will give you a more diverse foundation of learning in preparation for that sort of practice. So absolutely, we'll do our best.
And do I have to do a rural placement?
Absolutely. These are easy questions to answer, aren't they? Sorry. Again, a caveat. If you have extenuating circumstances, and by that I mean you might be breastfeeding a 3-month-old child. Well, I don't expect you to go to Sejuna to do a placement for 8 weeks whilst you're breastfeeding your baby. Unless your husband and your baby want to go with you. That's an option, isn't it? Absolutely. But there are some criteria. If you meet that criteria for extenuating circumstances, we will most definitely consider a variation to your placement.
Do I need the COVID vaccine if I go on placement?
Good question. It's a question we have yet to be answered. So we are waiting for SA Health to give us some direction around that. At the moment, they have only, in the last 24 hours, rolled out the first lot of vaccinations to our most vulnerable. So people providing care in clinical environments and our aged care in residential environments. There is talk that if you are on placement and that environment are providing COVID vaccinations to their staff, you may be invited to have a vaccination then. But you have to meet that criteria. You have to be on placement and be invited. Now, until we hear more concrete expectations around students and COVID vaccinations, I don't want to make any sort of speculations without giving you a really clear plan. So once we know what the plan is, we will communicate it with you, okay? It will come via email, and the website, the placement website, will be updated, all right?
Yeah, that follows on from another question. What if I don't want the vaccine?
Good question. At this point in time, the COVID vaccine or vaccination has not been deemed mandatory. What it might mean, though, is that some clinical environments may demand that their staff and students are vaccinated. And it might be because of the nature of the clientele that they're caring for. So, for example, in a aged care environment, they may expect all staff and students to have a COVID vaccination. In theatre, they may not, depending on the expectations of that particular venue. So once we know that, we'll have a better framework within which to guide and support you.
Excellent. With work and placement, is it that we're not allowed to work at all, or we just have to work around our placement?
So whilst you are on placement, you are not to be working at all. Is that clear?
Yeah.
If you are not on placement, then the expectation is, yes, you could be working, navigating around your study, your class timetable, all of those expectations. But during placement, you are not to work.
They need to start saving quickly.
Yes, planning. You know, you've enrolled into either a 2-year or a 3-year program. We've just identified what that means around placements. So if you're going into first year, there's a 10-day window where you're going to be on placement and you can't work. In second year, there's 2 windows of 4 weeks where you can't work. In third year, there are 2 windows of 8 weeks where you can't work. So planning and preparation is key to your success.
Excellent. And what kind of financial support is there available if I'm struggling to meet the demands of pre-placement compliance documents, pre-placement requirements, and or travel?
You are encouraged for financial support to visit FUSA, which is the Flinders University Student Association. I always struggle with that association. And they sit up the hill in Flinders Connect, and they will be able to guide you around what support systems that you may be able to meet the criteria for around placement attendance and or achieving placement compliance. Okay?
I can look it up online if you want, this support for...
Excellent.
So for pre-placement vaccines, what if there are health reasons that mean I can't have the vaccine? Is there any exceptions?
There's always an exception to every golden rule, let's be brutally honest here. So, for example, you might be pregnant and not be able to complete a vaccination regime. Then what I would strongly recommend you do is email the placement team. They will review your situation, and potentially you and I will have to have a conversation and try and navigate what that means for you and meeting your placement compliance requirements. It may mean that we look at a different placement at this point in time. It may mean we delay your placement a little bit. There is a little bit of flexibility in that situation, and we're very happy to work with people within reason. Does that help?
So just up on this behind me here, I'm in the student section of the Flinders University homepage. So I've clicked on students, I've come in as a student, and I've scrolled down the page a bit, but it says here, view all supports and services. And there is one tab there that says financial support. So you can go there for the information about what sort of financial support you might be able to get. Okay?
Actually, that's a good point. Who here has applied for a scholarship? One person in this room. There are multiple nursing scholarships available, and sometimes they actually go unawarded because they're not applied for. Yeah? So some of them are $1,000, some are $5,000, some are $30,000. So I would strongly recommend you jump on that website and have a look and see which ones you might fit the criteria for. You have got nothing to lose by applying for a scholarship. Or maybe a little bit of time. That's really a bit of time and a bit of effort.
And you can, FUSA are more than happy to help with those scholarship applications as well. So that's what FUSA are there for. They're your advocacy while you're in your course. So if you are struggling to apply for a scholarship because you're not sure where to start, then by all means please contact them, because they can help you with that application process as well. And it might give you a much better chance than sitting on it yourself and not being sure what to do. So give it a go.
Yeah. Access the resources the university has to offer you guys, all right? They're free of charge to you, yeah? If you choose to access them. Does anyone have any other questions around placements? Yes. Don't be sorry. Don't dare be sorry about a question.
What do you class as like rural? Like how far out of Adelaide would rural?
Good question. As much as it really, really pains me, Mount Barker is deemed rural. Yeah. What? I know. The geographical framework that we have to work within that's what it identifies as. Mount Barker is rural. However, Gawler out north isn't rural. Go.
Victor Harbour is.
Victor Harbour is. Strathalbyn is rural. Yankalilla is rural. Port Pirie, anything sort of further north is considered rural. Does that help? Yeah. Were you thinking of something specific? Oh. You're laughing then, aren't you? Mount Barker, Gumaraka, Murray Bridge, Mobilong at Murray Bridge, Manum, all of those areas considered rural.
Okay, just got a question here, Leanne.
Yep.
Kind of following from that, but if you live in Victor Harbour, can you still do your rural placement there or not?
Absolutely. Do you work there as an enrolled nurse?
I live in Victor,
Yep.
yeah.
But do you work in the hospital?
No.
Awesome. So there's 2 points here. One is you will get an email from the placement team identifying a self-select rural process. Okay, so this is really important for you to keep on top of your emails and check them regularly, because when the rural self-select process comes out, it's highly sought after. Students will have the opportunity to select the rural environment they want to go to, and they can be locked in to that environment from that point. Okay? If you miss that self-select process, and there's other rural placements left over in your block, they will be allocated to students that have not attended a rural placement. Okay? If you are working in a clinical environment and you have been allocated to that clinical environment for a placement, you have a professional responsibility to let us know. The reason why I say that is because, particularly if you're an AIN or an enrolled nurse or a carer, the team that you're working with already have an expectation of what your job is in that team. And your job is, as a carer, an AIN or an EN. That's what they expect of you, that's what they want of you, and that's what they depend on you. Yeah? It doesn't allow you to be the learner. It doesn't allow you to explore the extended practice from that role. So it's actually detrimental to your learning. So if we again, we're very good at helping, but we can't read your minds. So we don't know that you work in a clinical environment. And if we allocate you to that environment, please let us know. And we will do our best to work around it. We will work around it.
I've got another question here.
Absolutely.
If you're doing it part-time, will you be doing placement this year?
That's an Alicia question.
No, you won't. So when you go part-time, you do your theory components first, and then you do your practical the following year. So are you doing the 2-year or the 3-year program? The 3? 3. Yeah. So you'll do 2 theory topics in semester 1 and 2 theory topics in semester 2, and then next year you'll do your placement alongside the remainder of your theory topics. Yeah, and if you need a personalised study plan, you can contact us at any time, and we can draw one up for you. Yeah.
So all that conversation for you around placement compliance, put it on hold. All right? Because what you're going to do is you're going to spend some significant amount of money without and having to repeat it next year. So look at the checklist carefully. Things like vaccinations, so Hep B or your childhood vaccinations, you could be working on them over the next 6 months. Things like anything that's going to be less than a 3-year update, start working on, all right?
Okay. So if you only need to do 4 units, so you're doing the first semester as a part-time, and what happened for the remaining units? We're doing this, the remaining units in second semester, or we should continue the second semester units?
Yes, so the nursing program is very specific in that you can only do some topics in one particular semester. So the topics that you don't do in semester 1, you will need to do in semester 1 next year. So there's if you do 2 topics in semester 1 this year, then those other 2 topics won't be available again until the following year. So if you decide to go part-time, it will take you at least 2 years to be able to go back full-time, if that makes sense, because of the prerequisites and because of the way that the program is structured. So if you are thinking of going part-time, I encourage you to have a conversation with me first and see whether that's something that is what you want, because it is very difficult to then pick up and go full-time after that. We do encourage students to start full-time if they're even remotely thinking about it, and then withdraw before the census date. If you decide that you don't want to do full-time for whatever reason. So just be mindful, if you do go part-time, it will always take at least another year before you're able to do full-time again. A question about a breastfeeding policy, I think, on placement. Do you have a breastfeeding policy on placement?
Good question. So breastfeeding will be dependent on the environment that you are allocated to do your placement. Most of our clinical environments will support you as much as possible, remembering that you are there for a learning experience and that they may have some restrictions around visitors and those sorts of things. So there might be some criteria you need to meet in order to fulfil their requirements to meet babies' requirements. Does that make sense? It might be a bit complicated in some environments, but we'll work through it with you.
Excellent. And is the maths assessment for the drug calculations online or in class?
Oh, good question. In second year, they are in class, face-to-face, written assessments. And the reason we do that is because it is an ideal time to be able to provide you feedback if you're getting something incorrect. If it's online, it's really difficult to try and establish where the error is, and it doesn't support your learning in second year. So what we've done is in second year actually made a face-to-face hard copy assessment that enables us to walk through what you're thinking in trying to do the calculation and identify where the issues are and support you with that learning.
And sorry, just following on from that, will the maths attempt be more, were you allowed to have more than one attempt?
Good question. Before I go any further, it's not a maths test. Okay, I'm really sorry, but it's not a maths test. Maths is high school, primary school stuff. We are expecting you to have a grasp on maths, division, multiplication, addition, subtraction, decimal points, ratios, all of those things we're expecting you to come to university with. The assessment is around medication calculations. Students will be given 3 attempts. They'll be offered 3 opportunities to be successful to 100%.
They have to be 100% though before they're allowed out on placement.
There is,
that right?
yeah, absolutely. There is no leniency on that, and that is not our rule. That is the rule of our clinical venues. You need to be able to meet 100% accuracy in a medication calculation assessment before you go on placement. And I'm going to put it to you, if I came to look after your mum and I got 80% in my medication calculation test, would you be happy for me to give your mum's medications to her?
I wouldn't.
I wouldn't either. Absolutely not. In fact, I'd be mortified. I would want somebody that is confident and competent in their knowledge to administer medications. That is the very least expectation that any receiver of healthcare should expect, yeah?
Okay. Will we be able to see the results and like what we got wrong in it if we didn't get 100%?
Absolutely, absolutely. So in the hard copy, if you've got something wrong, we'll sit down next to you and walk through that with you. Absolutely. Otherwise, it's not learning. Yeah?
Just got a question up here too, Leanne.
Yep.
Do we get to practice a lot in class?
Yep. So depending on the topic you're in, it will be presented to you in different ways. There is a whole range of practice tests on I was going to, what is it called? The numeracy?
The numeracy, well, it might get a different name because it's under review at the moment.
That's right.
But actually on the, when you go on to Flow, there'll be some tabs, and one of those tabs is numeracy for nursing at the moment, but we are actually updating it. And once that's sort of updated, you'll be able to get access to it well before you need it. And within that, there'll be definite tests within there, examples, practice questions, those sorts of things.
I know for many topic coordinators that do medication assessments, they have past tests on their flow site for you to practice. So we will also walk through it with you in tutorials. During your clinical laboratory sessions, that there will be at times where you get to practice it in the clinical setting. Take a breath. It's going to be okay. There's a whole heap of resources that we've wrapped around you to support you to be successful. Yeah?
I'm feeling like the medication calculations is causing a little bit of anxiety. Don't worry, we will support you. We want you to pass too. We just need to make sure you're safe, okay?
Let's just find the other support services here. Online study skills.
In your diploma, you did a medication calculation assessment. For those of you that were medication endorsed, you would have had to do that as well, yeah? So what is it that you're most nervous about? Oh, sorry.
I think it's just that you have to get 100%.
Yep. And it adds a layer of expectation, which adds a layer of adrenaline and, yes. Okay, so the more adrenaline that's released, the less cognitive capacity. Yeah. So if we called it...
We just call it a pre-placement requirement. Or,
pussycat test, yeah.
Well, that's true.
Yeah. We'll do our best to find another name.
They're on there, so it's got basic math skills there for... So it's one of the student supports.
Awesome.
You'll be fine. Your tutors are well equipped to support you as much as possible.
Any other questions about placement?
Just had one come through on Slido before. What if I'm allocated a placement that I don't want to go to?
Don't have a choice. Sorry. That came out, didn't it? Sorry.
Well, wouldn't it be lovely if we had that many placements that we could have choices?
And that is a really clear point. We don't always have a choice. We don't always have a choice about the team that we work with, because nurses work in teams and our rosters are always different to our peers. We don't get to work with our friends, and we don't always get to work in the space that we would like to. Now, whilst I say that if you have an adversity to the placement that you have been allocated to for extenuating reasons, and you've got some evidence around that, then I'm very happy to review your situation from a variation placement perspective. But in general, you are required to do an aged care placement, you are required to do a rural placement, you are required to do a high acuity placement and a general med surge placement at minimum for those in the 2-year program. We have an obligation to provide you a diverse placement experience because your education is to be registered as a registered nurse generalist. So the expectation is you have had experience in a range of environments. Does that help?
Does. And does an extension for compliance change the placement date?
It could do. Absolutely. So if you apply for an extension, and whilst I appreciate sometimes the extension is because you've applied for a police clearance and you haven't got it back and we're waiting on a third party, the reality is sometimes that may mean that your placement is delayed and you fit into a later placement block. Yes, sometimes. That's all. Excellent. I'm going to hand back to Deb.
I need to know what I'm doing now, so I didn't expect this.
Sorry.
I think it's going to be mainly Katrina.
Sorry.
So I'm just going to check.
That's okay. Just quickly while they sort that out, there is a couple of other questions coming through about just general questions. At the end, we'll answer those as we go through. So you just keep submitting them if you've got questions as we go, and we'll answer them at the end during question time.
Okay. Which was your start of yours, Katrina? It's got my picture. It's got your picture. Okay. Thank you. So one of the things that, can you hear me? Yeah? I'm never quite sure whether these little ones are actually recording or not, or on. One of the things about coming, yes, that would be so much better. Thank you. Thank you. Turn that one off. Okay. So one of the things about coming to nursing is that you're going to be a health professional. It's a professional body. And we welcome you to it, but within that there's some expectations of your behaviour as well. You're going to be in this world where you are caring for people, and no matter what situation they're in, what health needs they may have, that is a person with needs, and you're actually privileged the fact that person is allowing you into their world, whether it's through communication, whether it's through your actions, your behaviour. You need to see yourself as privileged, that they're allowing you into that world. You're going to meet people from babies, children, adults, people with complex issues like addiction, mental health, palliative care needs, end-of-life issues, disability, a whole range of people that you need to be thinking about on an individual basis. What is that person's needs? What can I offer this person? But choosing Flinders is a great decision because we help you with all of that. We're here to support you across the whole spectrum of the life, of a person's life. And you're always going to be learning. It's not just in a classroom and it's not just in a clinical environment. You are going to be lifelong learners. If you speak to any of the professional staff, all the academics at Flinders University, we have an emphasis on we are always learning. So we actually learn from you. As much as you learn from us, we learn from you too. And there's always something that challenges us. I would like to think that I'm one of these people who can say, I know everything. And I don't. And that, you know, I have to take a big swallow and go, okay, I don't know it all. And take a step back and go, what can this person offer me? What can I learn from them? And that's not just tutors. The people you're going to be caring for are going to be the experts often in their own care. So my background is mental health. And, you know, I've worked in mental health for many, many years. And we call the people we care for the experts in their care. They tell us what they need, what they require, what we should be doing. Just like maybe when you're looking at somebody and you're asking them about their pain. One person's pain threshold is going to be very different to somebody else's. So you need to listen and respect the experts, okay? And you're always going to learn from them. Nursing is amazing. We're still here. I'd like to say we're still young, but we've been here quite. So I'm looking around at the three of us who are left. And I don't want to even combine the amount of years between us. But I know I started in the mid-80s at some point. I don't know about you, Leanne. Was that about the same time? Yeah. Katrina? Mid-70s. So... But it's going to be intriguing. Some of you already have the diploma, may have worked there as enrolled nurses. You know some of this, but those who are doing the 3-year pathway and are new to this, it's going to be daunting. It's going to be challenging at times. There's going to be times where you think, why have I chosen this? Why am I doing this? But keep with it. You know, make sure you stay. If you're struggling with any of those emotions, speak to your tutor, your topic coordinator, your student engagement coordinator, who we'll talk about in a little bit. So yes, it is going to be scary. It's going to be anxiety-provoking. I remember doing my first intramuscular injection and my hands were shaking like this. Of course it's going to be scary, but like any skill, it takes practice. And the more practice you do things and use your lab situations, the better you're going to be at it. So practice, practice, practice. And the wonderful thing is you're going to meet people from all different cultures, all different places around the world with all different experiences. And that in itself keeps it not only rewarding, but it keeps it interesting as well. Now I get to pass you over to, if you remember Katrina, she is our first year level coordinator as well as a topic coordinator. And I'm hoping she's going to describe some of the different roles in here as too.
Great. So come on in. There's some people that we've scared somebody off. We don't want to do that. Just please, just have a break, stand up, have a stretch, get some water. We're coming to the final bits. That's it. Stretch. Yeah. All right, that's enough. That's enough. Not too much of that sort of stuff around here.
It's the only break you get as nurses.
Oh. Okay, so just before we get on to the important thing of time management, you've heard us talk about tutors, you've heard us talk about topic coordinators, you'll probably hear us talk about casual tutors, permanent staff, sessional staff, part-time staff, full-time staff. You know, are we all the same thing? Are we all different? And I think for you, the important distinction that we need to make right up front is your tutor may also be your topic coordinator, but your topic coordinator can also be your tutor. So, you know, it's very confusing. So I'm a topic coordinator for certain topics, but I'm also a tutor So I teach intertopics. So when we say topic coordinator, we mean the administrative person that is like a sheepdog, herding you all in the right direction. They're making sure that you're on task, on track. But your tutor is your sort of first point of your contact. The tutor is normally responsible for 25 to 30 students, and they will get to know you a lot better than I would with 600 students as a topic coordinator. So that's really important. The role of the topic coordinator is to oversee a large topic usually, to manage all the tutors, and they're responsible for the topic, for the people that we work with, our bosses, I suppose, we're responsible for it, all the grades and things like that. But a tutor is responsible just for a smaller class, and they will be with you every week, and they're the people that you go to first, your tutor. They may well be, as I say, a full-time academic like I am, or we might have just employed them casually. So that's an important distinction in terms of roles. Now, we did start to talk about support services, and I just want to show you that, because I don't want to go into that in any more detail, because, this day you'll get overwhelmed with information. You won't remember all of this, but the recording will help. But I've come in as a student, and I come down to support services, and they're all the support services. So click on them as when you have time. The important one, I guess, is health and wellbeing, so that's about counselling, study and learning, and financial support. How to enrol properly. So they're the main things, I guess, I wanted to point to you at this time. Now, if we think about time management, you have 24 hours in a day. For those of you that are studying part-time, just hands up for those of you that know. So there's a few of it in the room. Okay. What I'm going to ask you to do now is an activity, and I'm just going to, we'll come back to that. This is your timetable. Now, it says that you start at 7 o'clock in the morning. Well, for many of you, you probably start well before that, and you end at 11 p.m. at night. Now, I'm sure that some of you will be in bed before that, and others of you have only just started to really get into the study pattern. Think about your week, and just talk to your neighbour. So you might have to move a bit closer to someone. Talk to your neighbour about when you're going to be on campus. Right, so have you got 2 days a week when you're on campus? Have you got 3 days? When are you going to fit your work in, if you're working outside for money? If you've got childcare responsibilities, where are you going to fit that bit in? Where are you going to fit in your exercise? If you're caring for someone who's elderly, when are you going to fit that in? And when are you going to block out your study time? So let's just have a chat to each other. It's someone you're sitting next to. Introduce yourself to each other, and just you might need to turn around and just join into a 3. When are you actually going to fit your study time in? So just have a chat about that for about 5 minutes. Okay, have a chat.
Remember, your study that you do doesn't just mean you're face-to-face when you're attending. It's all your self-directed study and assessments that you have to do in your own time away from campus as well.
Okay. So you've just started that discussion and you've probably started your thinking about how am I going to fit all of this in. If I'm doing 4 topics and they each require about sort of 8 to 10 hours study, including the time that you come to university, and yet I've got this 2-day-a-week job and my kids will want to see me at some point, and when am I going to study? So it's really important to think about this now because you need to get organised and you need to be planned. So who is a procrastinator? This is not looking good. It was at least half the group this morning too. We're going to be working really hard, us procrastinators, aren't we, to get the work done. So procrastination, because not everybody understands what we mean by that term, it means what? If I say procrastination, what does it mean to you? You have to yell. So all of a sudden, the washing up looks attractive. All of a sudden, the washing needs to be done. You sit down at your computer, you schedule 2 hours to do this study because you've got an assignment coming up, and you're sitting there, and because this assignment is a little bit difficult, there's an anxiety that begins to build. Now this is just everybody, you don't have to have an anxiety disorder to do this. So it's a bit difficult. Oh gosh, I think I'll just go and get that coffee. I'll just do the kitchen, clean that up. I'll just do this, or I'll just do that. Or gosh, Facebook, look, someone's just pinged. I've just got a notification about an email. So there are distractions. And we have to learn, us procrastinators have to learn strategies to do the most important thing first in a day. Because otherwise, doing things at the last minute, while it can be productive if nothing goes wrong, is not a good way to live. So when you're thinking about what's important and what's urgent, these things have to be planned in. So this is just an example. So if this was my particular study plan or weekly plan, I'd be getting, I couldn't study at night, so that'd have to go. I'd have to be sleeping at that point, but I'd probably be getting up at 5. So that's my trade-off, because that's when I work best. Maybe lunch would have to go. Gosh, I don't know that my family needs to see me that much. Study, socialising, well, sometimes you do have to be proactive with your family and a bit selfish in a good way, but you need to prioritise your own time. So if you've got let's say you have 2 days that you know that you're meant to be on campus face-to-face, and you've got another 2 days that you've put aside for study, then you need to come into, if your family are at home and they're going to get you, if you're at home because you're available, then you're going to have to think of ways of managing that. And so coming into the university, your family don't know what you do here. They just think you swallowed up in this big black hole and you just spat out again at night and come home and cook tea or something. But it's better to come here and study like you would a job than to stay at home and be distracted. At least here you have the supports. There are quiet study spaces in the library as well as you can talk in the library. But there are quieter study places to be. And so bye family, I'm going to the uni. So they don't know that you're here and what you're doing and whatever. So it's really important to be able to prioritise yourself and to be able to carve off bits of time, because if you're a procrastinator, like many of us are, it's going to be even more of a challenge. So have a think about that and how you're going to organise your work, because it's really, really important. And if we go back to some of these other slides, yes, a Bachelor of Nursing degree is full-time. It is expected that it'll be about 40 hours a week for 4 topics. That includes coming to class, labs, things like that, but also your own time. So when you're thinking about your 3-day-a-week job, something has to give. But we acknowledge that, you need to work. So that's where part-time may be an option. So if we think about getting organised, think about the things that will help. I like lists, but I also like scheduling things into my diary when I actually do things. Otherwise, a list can, what do they say? 40% of a to-do list never gets done. You actually have to put it in your diary, schedule it in your calendar. And if I said the number 1440, I don't mean 20 past 2. What do I mean? 1440. Sorry? 240? No. 1440, yeah, sorry, yeah. No, not 14, it's not that time. 1440, 1,440, the number of minutes in a day. Okay, so we have these minutes, and once they're gone, they're gone. We never get them back. So minutes are the most precious resource that we have, and they become more precious the older we get. So the people we care for, those that are older, will give us these gifts every now and then, and they'll say things like, don't waste your time. Make every minute count. And we know that intellectually, but you've got to know it here as well. So make every minute count, because once they're gone, they're gone. We're just going backwards now. Pauline's just come back in with. Get to know your class, your people in your class. Explore all the information on the university website. Look, it's too much to go through today. Create a study space at home. It's hard if you have to study on the kitchen table and then people have to come and eat. Participate in class activities. Be an active learner. Ask questions. These are your fellow students, the people that you meet here today are one of your best resources. So I think we've gone through those things. So when you're looking at your study, make sure you include things about children. Hair appointments. Well, during COVID, that was a moot point, wasn't it? No hair appointment. Life will throw us something unexpected and talk to us, because we can't always plan our life down to the final minute, because, strange things do happen. So I don't know whether Danielle's here. No. Eat well, sleep well, all of those things. It's not rocket science, is it? We all know this. But it becomes more important, especially the more stressed you get. So that's it from me. Pauline, did you want to?
I can talk a little bit about Danielle's role. Yeah? So just following on from what Katrina says, while Pauline and I see lots of students for various reasons, one of the most common reasons actually is progress. And often when we sit with students, there's obviously some students have extenuating circumstances why they haven't been able to progress, but a lot that we see are actually everything to do with what Katrina says, is the fact that they haven't planned their time well and time has got away with them, and that it's meant that they've handed in assignments late, that they may have failed the topic, that they haven't attended tutorials, that there's implications for their study. And some of those students, we then have to sit down and think about their study plan along with Alicia and say, how can we move you forward? We can do so much, but it's actually up to you as adults as well, that you have to take responsibility for your time. We really can't take that horse to the water and make it drink. That has to come from you as adults. In saying that, we recognise that students sometimes do find it difficult. They may have issues that are either financial, health orientated, that they're just struggling with a situation that's out of their control at that time, that the pressure of studying is too hard, they didn't realise what commitment was needed. And we do have what we call a service role within the university called a student engagement coordinator. And unfortunately she wasn't able to be here today, but that is Danielle Cross. You'll see a picture up there. Danielle is our student engagement coordinator, and I strongly encourage you, if you have any of those issues that I have just mentioned, please contact her. It's one of those things, again, that as an adult, you're accountable to go to somebody and let us know. Let us know that there's an issue, because if we don't know about the issue, we can't support you. And we really do want to support you. We want you to pass. We want you to be successful. We want a workforce of nurses. You're our future. So we will try our best to support you. So Danielle's role within that is to look at, have a meeting with you. She likes to do face-to-face as a priority, so make an appointment with her. Her contact details are on the bottom. Make an appointment with her, and she will direct you to what resources that are around, whether they're on the Flinders website, whether they're elsewhere. She'll be able to look at what resources are available, but also have a discussion with you about how can you balance life. What's got to give then? What have you got to do? What has got to change in your life to make it so that you can move forward? And within those discussions, it may be that she refers you on to somebody else, to health and counselling, to Pauline or I, but she's a first port of call. So you can contact her directly. Alternatively, your tutor or topic coordinator may contact Danielle. So if, for instance, you haven't attended the tutorials for 2 or 3 weeks, or haven't handed in an assignment, then an alert comes off, for the topic coordinator saying, oh, I'm a bit concerned about this student. They haven't contacted me. They haven't asked for an extension. I've heard nothing from them. Haven't seen them. They're not responding to emails. And we would say to Danielle, please, can you follow this student up? And so it could be that a tutor or topic coordinator refers you to Danielle to try and engage you as well. And so it's a very important role that we would like you to use. We want to try and keep you engaged. We don't want you to drop out. We want you to complete the 2 or the 3 years that you have enrolled into and be successful at the end of it. So keep her name, write it down. There'll be information on the website about her. She has a sheet of paper with all her information, very similar to this, that gives you a little bit more detail and is easily contactable. She does have an office, and she does have drop-ins, but as you can imagine, she's teaching, she herself is coordinating topics. She has appointments when she's seeing students, so doing drop-ins isn't always the best bet, but we understand that sometimes emergencies happen. Okay? Okay, so I think you're getting the point here. It's about looking after you. We'll try our best to look after you, but you need to look after yourselves too. It's so easy to get into this study mode that you go, oh my goodness, I've been sat at this desk or kitchen table or, dining room table for the last 6 hours and I can't remember the last time I had a drink. Now, how's that going to help your brain cells work if you're not replenishing yourself with fluids, if you're not making sure that you're taking your carbs and your protein to keep yourself energized and those brain cells working? So please take good care of yourself. It's very easy, if you're a procrastinator, to be up till 2 o'clock in the morning doing that last assignment when it's due at 8 o'clock the next morning. So, you're not going to have a good sleep pattern then if those sorts of things are occurring. So you really do need to take some responsibility about planning your life, thinking what it's like, and making good choices. If you know you've got an assignment due on a Friday, or we don't normally have assignments due on a Friday, maybe on a Thursday, then, think about, actually, I'm going to try and make it so that assignment is finished, completed by the beginning of the week, so I can look at it again, re-edit it, send it into the software that we have, which is called Turnitin, which you'll learn about, to get it back in plenty of time to submit it on time. Okay? So make good choices. I think that's it. We want you to enjoy it, ultimately. We want you to come here and at the end of this course go, wow, I'm now a registered nurse and I actually had a fun time and I met some amazing people on this programme that are going to see me through. You may work with them in the future. They may be friends socially. And, you know, I still go to places today, to a GP clinic and see the practice nurse and they go, oh, is so-and-so still there? And it's a topic coordinator or tutor that's been here a long time, and they remember that person. They remember who that person is. It was always Elsa, who everybody asked me about, who's actually just retired. So fun times ahead, people. Is that the last one? Yeah, so now it's any questions. Some may have come through on Slido, but any questions in the room as well. And we'll see between us. Hopefully we'll be able to answer you, because I can't always answer everything.
We're getting quite a few questions about lectures, and will they be delivered online and then recorded on, updated on Flow, and how they'll be delivered?
Okay, so our lectures, we don't have the traditional lecture theatres like this anymore, and that was partly because of sometimes it's just us talking and you listening, and it's not very engaging, and we've just said we want it to be fun, and we're interested in hearing from you. And so we've tried to avoid lectures as much as possible, but if we do have lectures, then they tend to be videoed and put online for you to access via Flow, okay? So if there's lectures within your topic that they ask you to look at, they will be accessible. There's nothing that you have to attend in a lecture theatre as such. The places that you have to attend, or we want you to attend, are the tutorials, the labs, the workshops, and your placements, okay?
Excellent, thank you. So we had a couple more questions just about the maths quiz.
Put your laptop down, Leanne.
But I think we've pretty much covered a lot of that. So if anyone's got any specific questions about that, again, then please send them through. But they're looking a little bit like they're doubling up a little bit.
Yes.
My only advice is please don't stress too much about it. Please talk to your topic coordinators if you are really, really concerned.
Yeah. Nothing else? We've got one over there, if there's nothing.
Do we have to wear uniform for, is it the labs and workshops?
You're talking to the right person.
Absolutely. So your clinical skills laboratory will require you to wear your clinical uniform. The reason for that is that it is a simulated clinical environment, and what we want you to develop is a behavioural memory. By that I mean, when you've done a late and got home late and tired, and you're getting up at 5:30 in the morning to be on the road at 6:15 to get to placement on time, you don't want to be thinking about what you need to wear. You want this automated memory that you know that when you walk out the door, you've got your bag over your shoulder and you're in uniform and you can get in the car and go. Okay? So the best way that evidence has shown us to form that behavioural memory is through repetition. So if we make you wear your clinical environment in the clinical labs, you will form your behavioural memory. So yes.
Any other in-house questions?
Got one over here. Oh, hang on. This is getting my steps up.
I was just going to ask, when it's cold, are we allowed to wear a jumper over our uniform?
No. The reality is you're in a clinical environment, so you need to meet the expectations of the clinical environment. And a key principle you'll learn is bear below the elbows around infection control. So you can wear a t-shirt under your uniform top, but it needs to be discreet and it needs to look professional. Okay? You can certainly wear a jacket or a cardigan. Well, that's an old term, isn't it? Cardigan. A hoodie to your class and back. Remembering you'll be in an air-conditioned environment, so that should be... And you will be busy. You'll work up a sweat.
Could you please explain in detail what the clinical uniform is?
So if you go to the placement website, you'll be able to see it. Let me just find it for you.
A general question. Do we need to wear that uniform in tutorial as well, or just in the lab or placement?
Just your laboratories and placement. Normally you'll have a tutorial that's either before or after your lab anyway, so you'll end up probably wearing it for most of that day anyway. But yeah, usually just for those clinical environments. We've got also a question about where do I go for help with my assessments, or if I've got any questions about my assignments.
Okay, so your first port of call for help with your assignments, as far as maybe you don't understand the assignment, you don't understand what the question is asking, is always your tutor. Remember, Katrina explained the difference between a tutor and a topic coordinator. The person who's in front of you in that class will give you their contact details. You contact your tutor in the first instance. If there's a difficulty with your assessments or assignments in regards of you need extra time, or you're struggling with it, or there's something happening in your life, contact your topic coordinator. Similarly, if your tutor can't answer your question, maybe they've got a little bit confused about the assessment because they've had so many questions coming their way, they may go to the topic coordinator as well, who will answer that question. If you are struggling with academic writing, so you're struggling with the level of what's required in a degree program, then we actually have some excellent resources on the Flow website. So again, Katrina showed you that drop-down box from students and all the different resources. In there, you will find resources that help you with writing, referencing, how to avoid, academic integrity issues. They're the people, and there's actually people you can make meetings with that will help you and go through some of that, how to lay out an outline or plan an assignment, what is required. They're the support services you need for those sorts of issues. Hopefully that answers the question.
Just going back to the uniform question. So this is what's on the placement website. It links you through to Valerie Travis, who is our supplier of student clinical placement uniforms. The tops for females, you can get a choice of the tunic or the blouse. You have a choice, of course. When you order, it will come with the embroidery on it that denotes you as a nursing student. The trousers are black trousers. We had a question this morning around, can I wear scrubs? And the answer is no. And the reason why the answer is no is because scrubs come in a range of quality. Our role is to best position you at the end of your degree for employment. In order to do that, we set some expectations, okay? That includes placement hours. You're expected to complete the placement hours for each topic, and you're expected to present as a nursing student in the SEC uniform. The image that you present will represent you as a health professional and a future registered nurse, and reflect on the university. Your professional integrity is about how you present and conduct yourself. And that speaks volumes to your employability at the end of your degree. Does that help? Yeah. Awesome.
Lovely.
There's one question here. If I cannot attend a full day of classes due to a prior important commitment, what can I do?
Okay, so again, the first port of call, you contact your tutor. You let them know that you won't be attending. Now, it's very, there are some different, requirements for different topics. So for some, what we do is 100% we want you to attend, whether it's tutorials, whether it's labs, we want you to become engaged. It makes your life easier if you're in a classroom with us. Trying to do it by a book, thinking, oh, I don't need to attend, it's not compulsory attendance, and trying to struggle with the readings or knowing exactly what we wanted in the activity doesn't help you when it comes to assignment time. So we encourage you to attend all tutorials 100%. Some of the laboratory workshops are compulsory. You have to attend. So, go on.
So the reason why you have to attend is because when you go on placement, we make a statement to our placement providers that you have learnt both the theory and the practice of the clinical skills you're expected to perform. And I go back to my analogy that we did earlier. Would you like me to put a catheter in your mum if I had never practiced it before?
No.
Henceforth, you need to come to the clinical laboratories to practice the skills to ensure you are safe and competent at the skills you're expected to undertake during placement.
In saying that, tutorials, which is your theory, we know that things sometimes crop up in life. We all have, you know, one of the kids has got sick, or, you know, the dog's been attacked on the way to the park, or I've been in a car accident. We know these things crop up. So in tutorials, if there's something, an appointment that you need to make and you can't make that tutorial, then let your tutor know. There's no implications of you missing that tutorial, but we do expect that you make up that work on your own. Your tutor or topic coordinator doesn't give you that work at another time. Unfortunately, with that many students, we haven't got the time to do that. So it's your responsibility to make up that time yourself in tutorials. Okay.
Excellent. When and where can I apply for a rural placement, and is there a list available beforehand?
We did address this earlier in relation to the rural placement selection process, where you will receive an email from the placement team seeking your request to undertake a rural placement in a given setting, and you can select the setting, and following review of your selection, if you've not been to that environment before, or if it meets the learning outcomes for your topic, then you will certainly be locked into that placement. The secret to your success in rural selections is monitoring your emails closely. Often the rural selection process it's open for several days, but the offers are taken up really quickly. So check your emails regularly and often.
I can't reiterate that enough, just checking the emails, because that often you will get, there's no doubt about it, you will get inundated with emails, not just from the college but from the university as a whole, and you'll start scrolling through them going, oh, that's not applicable to me, that's not me. You look at the subject line. Please read everything. It's really important, whether it's an announcement on Flow, whether it's an email from your tutor or your topic coordinator, whether it's an email from us as a college or the course coordinators. Read everything, because sometimes that will have important, vital information. It may be that, dare I say, you know, COVID happens again and we need to be telling you, don't attend tomorrow, don't come. Yeah, don't go to placement. So you need to be checking your emails daily, and you need to be up to date and read everything. Don't skim read it.
Can I just build, sorry, Alicia, can I build off the back of that? In the last, what day is it today? Wednesday? Wednesday. In the last 2 days, I think I've met with about 20 students who are in jeopardy of not being allocated a clinical placement. The primary reason that they are at risk of not being allocated a clinical placement is because they have not met the compliance requirements. And often it is a silly compliance requirement, such as ticking a box around, yes, I'm fit for practice, or yes, I've read the integrity declaration. But because they haven't read or checked their emails and they haven't addressed the email or didn't think the email was pertinent to them, they did not act on it. I cannot stress enough, read your emails carefully. If you are unsure about what the email's asking you to do, respond and clarify the questions you have. Okay? These guys are in jeopardy of extending their program by 12 months. Simply because they did not read their emails frequently or carefully. Yeah?
Just before we have another question, I'm going to follow on from the previous conversation and questions about the rural health. You haven't shown this already, have you? No, good. No, that's all right. No. She might be. Yeah. So I'll play this. So this is our Flinders University Rural Health Society, and you can become a member of that.
So FIRS is Flinders University Rural Health Society, and FIRS is all about giving students the opportunity who have an interest in rural or country practice to get exposed to it. So we run events all out the year, which is all about giving you guys a little taste of the country. So some of the events that we run throughout the year are like our rural high school visits, where we go out to rural high schools and talk to students there and tell them about the degrees that we're studying. Great thing about it as well is you also get to see lots of attractions the state has to offer, like the big orange out in the Riverland and the painted silos in Canalpa. Other events we run as well are experiences with the Royal Flying Doctors, where some people even get to go on the ride-along program with them. We always have our plastering night and wilderness health night, where we have the snake catchers come over talk and tell and show us all the snakes that they catch over the years. We've got a quiz night coming up this year, as well as the new Riverland camp. So great things coming.
Hi everyone, my name is Alison and I'm a speech pathologist working in country health in Riverland. I've been here for 12 months now after graduating from Flinders in 2019. And during my time at Flinders, FIRS was a huge part of my whole university experience. I started out as the discipline rep for speech pathology, and then in my third year I had the opportunity to be the co-president for Allied Health. And if I had to pick my best experience from my time with FIRS, it would probably be a combination of all the rural high school visits. So I had the chance to go out to Renmark a couple of times and also to Mount Gambier. And these visits are when you go out with a bunch of other FIRS members to a rural town, either for a day or overnight, and I guess present to rural high school students, encouraging them to come to uni and study a health degree and sharing what we love about your degree. But at the same time, we just get to meet a whole bunch of other uni students from different health degrees and get to know what they're studying, but also just have a bit of fun. I think either way, if you sort of know that you want to work somewhere rural after you graduate, or if you just want to meet some other people while you're studying at uni, either way I think joining FIRS would be great.
Hello, my name's Sam. I'm currently just an everyday member of FIRS. In the past, in 2019, I was the co-president of medicine. Currently a final year medical student and also president of Flinders
So if you'd like to become a member of FIRS, register at the NRHSN website, and if you want to keep up to date with all our events and what we've got going on, follow us on Facebook.
Nothing else is going to start, that's good. I'm always nervous when I turn one thing off. Often what happens is something else starts up that we weren't expecting. Did you have some more questions online, Alicia?
We do, yeah. If we are unwell for labs, workshops or placements, workshops, and can't attend, do we need to make these up before attending placement? And if we are unwell on placement, do we need to make up the hours?
I'll talk about the workshops and tutes and things. So as Deb mentioned, the tutorials are not compulsory, but the content that you would have learnt in that you need to make sure you've covered. So make sure you've read the necessary preparation and done the work and covered off the content that would have been covered in that time. That's where it's really good to get to know the people in your tute groups and get a buddy and make sure that they're happy to have a conversation with you and share any notes or key points or anything that might have been mentioned in a class that you've missed. With the workshops, where possible, we want you to attend those, but at the same time, of course, if you're unwell, we certainly don't want you coming in and sharing your unwellness with anybody, whatever form that may take. There are different requirements in different topics about how many sessions before we would need to have a conversation with you. So if you miss in most cases 2 or more sessions, then we need to have a conversation about whether in fact you'll be able to do a placement or whether we need to change your enrolment to a different time. It may be that you've broken your leg, so you're not going on placement. It may be that you have the flu and you're really, really sick for 2 weeks, but then you're better after that. So everything's going to be different, so we need to have that conversation with you to work out in your situation, given what you've missed, what can we do with you and for you to make sure that if you go on a placement, you're safe to do that, or that you need to do some extra classes. So it's a little bit individual in that regard, but there are some rules around that, ideally you miss none, but there is a few exceptions because of, exceptional or unforeseen circumstances. But in terms of placement, hand over to Leanne.
When you undertake a placement, you're undertaking a placement attached to a topic. The topic requires you to do a set number of hours. So, for example, if you're enrolled in 1005A, you are expected to complete 80 placement hours. If you're enrolled in 2002, which is the first clinical topic in semester 1 of second year, you're expected to complete 80 placement hours. Now, having said that, we do not want you to go to placement if you're unwell. In fact, you should not be going to placement if you're unwell because you're spreading your germs to some very vulnerable members of our community. If you are sick on placement, you're expected to negotiate with the NUM on the ward or the nurse unit manager and your facilitator around make-up hours. The expectation is that you complete the topic hours required of you to meet the learning outcomes. In some instances, this may not be achievable, and we will negotiate and support you around that when that occurs. Okay, does that help?
Excellent. Interestingly, a couple of questions about international study. Obviously, due to the current climate, international study won't be on the cards at the moment. Our study abroad team are still on campus and they're still happy to answer questions about doing offshore study and study exchange programs. But for the moment, my understanding is that they have obviously been paused due to COVID. And the question is specifically about whether you can do it in first year or do you have to wait till second and third year?
So the international study abroad programs that we would normally run usually happen in third year, sometimes at the end of second year, just depending on what the specific program is. We have a carryover program that we have funding for, and we're waiting for an opportunity to use that. You know, fingers crossed if you're in first year or just commencing the second year of the program now, you know, who knows, in 18 months' time, this might be possible. So you might be primed to be able to apply for those opportunities. The last opportunity we were planning to do was to go to Vietnam with the midwives and do a 2-week study abroad tour there. We've previously been to Indonesia, China, where else have we been? A long time ago, Japan, Canada, I'm wrecking my brains now, it's been a while ago. But we always have new opportunities and things coming up, and we're not quite sure what the future will hold. We might reinstate New Zealand. We did do New Zealand a little while ago, but that might be one of the first opportunities we get. We just don't know. So we're always keen to do it. We know that it adds a significant amount of value to your course, and it's a really great learning opportunity, and we constantly apply for funding to the federal government to support those programs so that it reduces your costs if you participate in that. So fingers crossed, you never know. 18 months' time, we might be doing something.
Let's hope. If you need an enrolment course advisor to go, I'll come. No, I don't usually go on those. Are we provided with online textbooks? Are we required to purchase our textbooks?
Yes, so there is a textbook list on the university website, and you literally type in textbooks into the Flinders University search engine, and it will take you to a page where you then just enter the course that you're doing, and it will, or the topic actually, and it will bring up the textbooks that are required. We know there's a bit of a problem if any of you are enrolled in Nurse 1003. There is a textbook required for that, and for some reason it's not coming up on the list, and we're not sure. We're following that up. But for the most part, those topics and the lists are there. If you scroll up to the top and in the search engine, pop the topic code. And so the topics, the textbooks are listed there for the topics, but once you're in a topic also, they'll be listed. I recommend that you go here first because you may need to purchase them in advance or wait for them to be delivered or things. There are also links about the sorts of places that you can get them. You can buy them online, and they can be delivered to you. The publishers also have their own websites, and you can buy direct from them. Where we can, we talk with our publishers to package textbooks together to reduce the cost. So you might buy something that you need for this semester and next semester together and reduce the cost of the two of them. We also only ask you to buy textbooks that you'll be using in multiple topics or we think are essential books for your professional library for your lifelong learning and going forward. So we don't expect you to buy everything. We may have a long list of things that you might access or utilise, but if you're going to access it regularly, then we'll call it a required text versus a recommended or optional or elective, or there's a range of other words that people use. But if it says it's required, then that means you'll be accessing it frequently and regularly. And so the sooner you buy them, obviously the better. There are textbooks in the library, but the library purchases textbooks at around about a 1 to 30 student ratio, and they're on restricted access so that more students get access, so you can't borrow it for 2 weeks and take it home and forget to return it. Most of them you need to use in the library for either 2 hours, 4 hours. You can borrow them maybe for 2 days, but it's quite limited so that everybody can have some access to the textbooks. Sometimes students from previous years will sell textbooks secondhand. Make sure you inspect them before you buy them. You want to make sure it's the right edition, and you also want to make sure that they haven't, removed any pages or written over it to such an extent that you can't make head nor tail of what was supposed to be there. And just make sure, most importantly, that it's the right edition. That's going to be really important for you.
Excellent. I think there's a couple for me. There's a couple of questions about transferring to other degrees. I don't like these ones already. Have we put you off already? If you do want to transfer to a different degree, there's a couple of questions about GPAs and that kinds of thing. I recommend that you make a time to come and see me, because some courses can be available for internal transfer and some can't. If midwifery, I think one of the questions was about midwifery. If you're looking to internally transfer to that, we actually don't offer that internally transfer. You need to apply for that through SATAC, but you also need a very high GPA to get into that with at least 18 units of study under your belt. So if it's something that you're looking at or considering later on, then certainly contact me through the NHS Inquiries email address, and I'll be more than happy to meet with you, as all courses are quite different.
Can I just feed off the back of the textbooks? Actually, before I do that, come introduce. We've just played your video, only because we were running ahead of time. So come introduce yourself, my dear.
Thank you.
And spread the rural message.
I will do it best I can. All right, sorry guys if I'm a little bit out of breath. I just marched up from the medical centre. So hi, you probably all heard about me already, but I'm Hugo. I'm a second year medical student, and I'm also the medicine co-president of FIRS. So FIRS spreads across medicine, allied health and nursing, and it's all about giving people the opportunity, if they want a taste of rural practice or rural life, to get it really. So through the events we run, it's all about trying to give you the exposure, and it's a really great thing. I was really hoping to get a nursing student on the video for you, but they were quite busy, so I wasn't able to do that. But some of the amazing things that our nursing students who have gone on to be nurses now, they're practicing up in the Northern Territory. They've had some amazing experiences, and they've said that FIRS has helped them get that confidence to go and take that step out there. So it's all about just getting that little extra taste, and like Alison would have said in the video, those rural high school visits are a great way of testing that out. So not only will you go out to those rural high schools, but you also quite often will actually be at the hospital itself as well. So we'll have a tour of the hospital, we'll get to speak to the staff there and hear about all what country practices are like. And probably the last little bit I'd let you know about is, so part of my medical degree, my entire third year is going to be spent in the Riverland, and building up to that, I would go out there in my first and second year, and one of that times was I had a follow day with the nurses there at the Loxton Hospital. And one of the most amazing things about that experience was that entire hospital is run by the nurses there. The doctors are only called in when they're needed. Otherwise, they can just stay out of the way. So the great thing about the way they ran it was that the nurses were all in charge. They knew what was going on, and it really highlighted what I think a lot of the public miss, particularly in tertiary and metropolitan hospitals, is that the nurses do a heck of a lot more than that's actually recognised. And you could really see that in their practice there. One of the funniest moments for me was one of the nurses telling me how they'd speak to one of the metropolitan hospitals, and they'd say, we need to talk to the bed manager. And she'd go, yep, I'm the bed manager. No, you're the nurse. Okay, one moment. She'd put the phone down, wait 30 seconds, go, hello, bed manager speaking. So it's one of the great things about that is you get a bit of everything doing. So we just want to give you a taste of that, a bit of an exposure, and hopefully you can grab on to the idea of it and go on a rural placement. I had the RDWA, which is the Rural Doctors Workforce Agency, come and talk to the med students recently. They are branching out more now with allied health and nursing as well, and a great thing that I would add is that we will be doing the Royal Flying Doctors Ride-Along program again this year. So that's a whole day where you go sit at the airport there, and if they've got to go to Pinaroo, you go to Pinaroo with them. Or if you go up north, you're flying with them. So that's a great experience. If you are interested in any of this, please go to the NRHSM website, register to become a FIRS member, and follow us on Facebook. That's the best things. That's where all our events are. That's where we'll keep you up to date with it. Probably in 2 weeks, we will have a intro night or a welcome night. We're probably going to hold it up at the TAV. We're thinking probably around the 9th of March. That's just come have a chat. We'll have lots of FIRS members there who'll probably do a little Q&A, very similar to what you would then get to do on a rural high school visit. So, get a bit of exposure there. And just see if it's something you like. It's completely free to join us. Quite a few of our events have like a $5 fee or something like that, but that's really just to make sure that, if you pay for it, you're going to probably come to it instead of just registering and, we think we're getting 150 people and we get 2. So, yeah, that's pretty much it. If you've got any questions, happy to take them. So, far away.
Can I ask a question to you?
Absolutely.
Do you originate from a rural environment?
Yes, I do.
Whereabouts?
So I grew up in the upper southeast, which is a small town of Tintinara. Has anyone ever driven to Melbourne from Adelaide? Yep, so you would have gone through Tinty. Blinked and you would have missed it, but it's out there. So 125 in my school from reception to year 12, 5 in my year 12 class when I did study. It sort of got me, having that rural background made me want to go back rurally as well. I call Adelaide the big city. I know it's not big city compared to a lot of other places, but there's just something about rural life. You've got a lot of freedom and openness and also connectiveness. Like, you're not just someone on the payroll. Everyone knows about you and everyone likes to check in with you as well, which is great. So if you're feeling a bit off, they know about it. So yeah.
Are all your members originate from rural?
No, quite a few members aren't. They're people who are curious about rural life and get that exposure and get that taste for it, which is great. Probably the biggest conversion I've had was actually my partner. She has just finished nursing. She's got her TPP at the moment. She's at FMC, and she comes from just north of Adelaide, so it's in the suburbs. But she was always a city girl. Didn't want to go away from the city. Was happy with the city, all the great things there as well, which is great, which is cool. I was like, just try the country a bit, see what you think about it. And I took her on a few rural high school visits, and she's now got the idea of she's going to come with me next year to the Riverland and get the whole year out there. And we're looking at the idea of maybe we'll work more rurally now as well. So just because you come from a city area doesn't mean you might not want to try rural. So you could always have a look. We're there to expose it to people. It's to show people around. I mean, the rural people, a lot of us who are in the program who come from rural are probably going to go back rural anyway. So that's great, but that's not what FIRS is about. FIRS is about opening it up to a lot more people. So, my pleasure.
More questions? Nice try.
I'll do the running. Where was it?
Thank you.
Yeah. Oh, sorry, the website? Have we got the website address again?
The website address, yes. Fantastic. Now, I hope I didn't blow your eardrums when we had the collage one, because I realised that my voice on that section is a lot louder than the rest of it. So I was doing the speech pathology one and I pressed play and I'm just leaning there and then I'm trying to turn it down. But.
Okay, we've got another question while we're waiting for the website to come up.
With being a first year nursing student, would you still go to just schools, or will you get to experience hospitals and going to see them and doing the Royal Flying Doctors Service, like you said?
So the Royal Flying Doctors Service, that's for any year nursing student. So that it is very competitive, but the best thing about it as well is that we'll get a different president to pick it. So it won't be like the nursing president picking it, so there'll be no bias there. But that's for any student. And there's probably, I think, there's about 30 positions. Please don't quote me on that for nursing, but that's for anyone. And with regards to the hospitals, the rural hospitals sort of thing, that's linked in with our rural high school visits. So anyone who comes on that gets that tour as well, or gets it. So that's down to our rural high school coordinator. If they are able to link in with the hospital, then yes, absolutely. If you go on that visit, you'll get that experience, or you'll get something similar. We always try and arrange in that it's not just about those students, but also about the volunteers who give up their time. And it's also free. Everything's free on the trip. You don't have to pay for anything. You'll get your meals covered, if transport's covered, everything. It's just bring yourself along, really. So yeah.
There you go, website in front of you.
Yep.
Contact details, Facebook page.
I like the video.
Good, I'm glad. Because I know.
There's potential to be a star, guys.
Yeah, absolutely. That's got to be my mission for this year, is to track down a nursing student and get them on there so I can put it into the film. So, and then that way I've got everything covered, and we can just come up here and do it like this instead of me droning away with a presentation and clicking through slides. So at least there you can actually hear it from people, and chatterboxes like Sam. So.
Awesome. Thank you so much.
All the best. Bye. Are we done? That's it.
Are there any other questions? Oh, now that's what I was going to, sorry, before Hugo interrupted, sorry. Cheeky sausage ears. Many of you guys have come from a diploma qualification, and you might have a clinical skills book called TABNAs. Yeah? Yeah? We use a different clinical skills book, and it will mean that you'll need to buy another one. And it's the reason why I make a point of it is because it's often a question that we get once we hit the clinical labs, and students go, but I've got a TABNAs. Yeah, that's great. TABNAs are focused towards the Diploma of Nursing. The clinical skills books that we use, and I'm trying for the life of me to remember the author, and it's escaping me at the very moment. I think it's not a Berman, is it? No, it's... Anyway, our clinical skills book, what it does is it prompts your thinking, and as a registered nurse, critical thinking sits alongside your clinical skill development. So you will learn to be more critical in the way you undertake your activities whilst you're doing it, which is a higher level of thinking than what's expected of an enrolled nurse, and henceforth why we require another textbook. Sorry.
It's the Berman one, isn't it? Is it the Berman? The clinical skills?
It's the new clinical...
I think it's this one, isn't it?
No, they're herbs. Cozier and herbs.
Oh, you want that one?
No, I want the...
Not the clinical skills.
Yeah,
That's the old one. Is this...
No.
Why is it not there? Okay, change the number up the top. Here we go.
I'll find it while Pauline talks to you.
Okay.
Just if they get me away from the computer today. That's what they're really trying to subtly say, but I can read between the lines.
Sorry.
So yeah, it is important to have a look at the versions and the editions, as we said about the textbooks, so always double check that. If you're not sure or the information is conflicting or confusing, have a look on the Flow site for the specific topic that you're enrolled into, and that will give you the detailed information of what the textbooks are for that topic for this year. So sometimes the list hasn't been up, or they've added this year's text to it and haven't removed last year's text, so that's why sometimes I'm just noticing we've got more than one textbook recommended there, but they haven't removed last year's recommended texts. So that might be part of the problem there, why it's not there. Are you going to flick on to the...
This is the one.
That's the one?
It's a Berman and Snyder. I'm just going to see if I can pick up a picture of it, because it's much easier to... visualise if you know what you're looking for, and there it is right there. Look at that. So that's from Angus and Robertson, which is a text provider.
Probably not the cheapest version, but
that's what our
Google and have a look who else sells it and for how much. I know lots of students use Booktopia because they deliver to your door. They'll sometimes do discounted prices, and certainly they'll package things together as well. And if you look at the publisher's website and see what deals they have available as well, and when in doubt, ask and negotiate. You can never lose out, and you might gain something, so it's worthwhile. Is there any other questions? No more questions on Slido? No? No?
Oh, sorry, one just came through.
Oh.
Sorry. Where do we purchase the textbooks required?
So, yeah, they're probably typing while we were talking and pressed send and went, oh. So there are a range of places, and we encourage you to explore those options to get the best deals and the best prices. And where things can be or are packaged together, have a look ahead at what are the topics that you're doing that might be a good deal for you going ahead to do that. So, for example, in 1001, there is a textbook called Communication Toolkit, and the publisher for that also publishes a dosage calculation book that is not required for that topic, but it's required in another topic. So they've packaged those together, and they've also provided us with a 10% discount link, which is available on the Flow site as well. That information is there. So, you know, where we can, we try and encourage them to do deals for you. Sometimes electronic versions of the books are cheaper. Sometimes you can get an electronic link when you purchase a hard copy. So really have a good look at what the offer is, and always ask, see what they can do for you.
Just one last question. Are black sneakers okay for placement?
So, the question is, are black sneakers okay for placement? The issue about something like a sneaker is that it's often a soft top or a mesh top, breathable, things like that, which means that it's also porous, which means that bodily fluids can sometimes land on your feet and come through those lovely shoes that you paid a lot of money for and wreck them, and they'll smell forever, and you won't want to probably ever wear them again. So you could, but I wouldn't recommend it. And when you say sneakers, I'd be very careful about, are we talking about logos? Are we talking about things that look like you're going for a jog as opposed to coming to work? Shoes are really important. They will help your knees, your hips, your back when you're on your feet on hard floors for long hours. So having a really good quality pair of shoes that protect your arches, your heels, and anything spilling onto your feet is going to be really important. You know, you might pay a little bit more, they'll last you longer, but ultimately they'll look after your health as well. So really worth the investment.
Trend setting's not the way to go.
No, although it's interesting, isn't it? Because clearly I'm not a trendsetter, but I should defer to Deb here. But is it? I'm going to say the wrong name, but there was a while ago where there was an English shoe that was new to Australia and particularly popular for very trendy people, but a lot of nurses took them up because they were incredibly comfortable and protective and leather, and I can't think of the name of them.
Not Skechers, the pardon? No, not Frankie's. You know, the broader, more solid shoe.
Don't mean Doc Martens, do
No,
you?
not Doc Martens.
Doc Martens did become popular for a while as well.
Doc Martens are extremely
Birkenstocks.
Showing my age.
Birkenstocks as well. So they're the two that have been quite popular with people because they are actually quite solid, a little bit more trendy looking for some people.
Okay, we've got another question here.
I just had a question about the immunisations and everything for compliance for the placements. I spoke to someone earlier today about finding out sort of like a list of what immunisations are required. Where can we find that?
So if you go to the placement website on the checklist, they're all outlined there. It will also take you to a Flinders University immunisation certificate that you need to take with you to your doctor and have him sign them all off, okay? It's all on the placement website. One of the key things to remember, particularly for younger students, is always check your Medicare vaccination record. So one of the key things that since our e-health records have gone online, since our health records have gone online to an e-record, what has happened is your information has been collated and compiled in a repository, and many students haven't explored what they did have as a child around immunisations. And students that are starting to come out of high school now actually had hepatitis B as part of their childhood immunisation regimes. Okay, so always check your entire health history in relation to immunisations. Does that help?
Are there any other questions? Oh, you've got one on Slido?
So this is about textbooks again. So a student was saying that they've heard from other nursing students that they've never purchased textbooks before, and they've just used the online textbooks that are provided by the uni. Is this okay, or do you recommend buying our own?
I'm interested to know about the online provided by the uni. So some universities have bookstores, or have in the past, they've had physical places, and then those organisations have had an online link. We don't have the book co-op anymore, and so the various other places that you can purchase books online, like Booktopia and direct from the publishers, and some of the other places are probably easier for you, and became easier particularly during COVID because everybody was ordering everything online. So you'll find that they are more popular and more commonly used, and they will have all of the books, or can access the books that you need to purchase.
If it was a past student, I know as of stopped in 2019, but there was 2 books that were online, freely online. So that was the one to do a book with 1003, the health psychology, and 1007, the mental health one. And that's because the uptake of those books was so large, the library actually gave a deal with the publishers, and they allowed them to have them online and freely accessible to everybody. However, things change. Money changes hands, and they stopped being online freely as of 2019. Yeah. So if it was a past student, I'm just wondering if it was old information.
Absolutely. And another one about shoes. Relating to shoes, can I wear work boots that are brown in colour?
No, they need to be black.
Black it is.
Just off the back of the textbook conversation, I would encourage you to think about how you best learn, because that might inform whether you buy an electronic version or whether you buy a hard copy version. For me, I need to flick through the pages, I need to scribble on the pages, I need to walk around, change positions, go and sit on the lounge, go and sit outside in the sun, have another read, tags, put lots of tags, use highlighters, all those sorts of things. That's how I learn. I don't do well electronically because I lose my page, don't know where I'm at, all of those things. So think carefully about how you best learn, because there is no point in spending money on one resource that actually doesn't work for the way you learn. Okay? Does that make sense, guys?
I sort of have 2 questions, if that's okay. One with the sneakers, does that go for the labs and workshops as well, that we're required to wear those? Yep. Oh no.
We're nodding there, yes.
Yes, because everyone can hear our heads rattle, can't you? Yes, we were nodding. So what you wear on your placement is what you should be wearing in the labs and the workshops, the same.
I think I've forgotten.
That's okay. The pressure, it's got to you. Oh, well, I'm sure someone else will have a question, and then we can come back to you. Yes, here we go. You've saved the day behind.
Is the placements email the only form of contact that you can have? Like, there's no number, phone number to speak to?
If you ring the college office, they'll put you... I start that again. If you ring the college office number, the number that I had up on the screen before ends in 00. It's
82017500. Not that I ring it often, but I've memorised it.
That it's a generic number, and whoever answers it, if you ask, could you please speak to someone in the placement team, and they will certainly be able to put you through. Okay?
For the first year student, do we need to do the compliance and health?
Absolutely.
Could you just repeat that, Leanne?
So the question was, if I'm a first year student, am I required to do the compliance immunisations? Are you full-time or part-time?
Part-time, I believe, from an earlier conversation.
I'm a bit concerned about this. I'm not sure what you mean when you...
And that's why we have the wonderful
And
Alicia.
that's why you need to have a conversation with Alicia, because
she's the expert.
No. So it's good to clarify this, because it will depend on the topic that you're enrolled in as to whether you need to do the compliance requirements. Because if it's not a placement topic, you won't need to. Best after this, you speak to Alicia. When you go to paramedics, they will have a series of compliance requirements you need to meet.
Yeah.
Okay.
Or make an appointment with Alicia, because I think she'll want to go home at 5 o'clock.
Yes. Does that help? Yeah, that's great. Thank you. Awesome. Any other questions, guys?
Oh, it's getting a bit 5 o'clock.
They have been really patient and really tolerant and asked amazing questions, which is wonderful. Absolutely wonderful. So for the last time, can I just remind you, start your compliance yesterday. Yeah? Awesome. I look forward to seeing you all around campus. Is there anything else that you ladies would like to add?
Not from me.
Not from me.
So we look forward to seeing you all next week. And
thank you for coming.
Explore. Thanks, guys. Bye.